Good morning, Anne Arundel County. Thank you for joining us today. Just a couple of things that I want to go over about your incredible fire department and what we have been doing. The role of the fire department has not changed during these extraordinary times, but what has changed is everything about what we do and how we do it. While we're still running calls for service and we're still taking care of the community, our preparations and the way that we close out calls has definitely changed. So just for example, the PPE that we wear has changed. We may look very different than what you're used to seeing on calls. Our 911 call processing has changed, where now every caller is being screened for signs and symptoms of COVID-19. How we transfer patients in the hospital has changed, and the procedures that are being used within the hospital for how patients enter has very much changed for us. We're learning new medical techniques, and we're learning new medical procedures, which is something unique for our EMTs and our paramedics. The decontamination process has become much more robust, and it's definitely a key point of what we're learning and how we're training. All of this requires a great amount of training into our day, and the amount of information that our firefighters and EMT must process has been extraordinary in such a short period of time. We have new protocols that we've been abiding by and working with the state. And one of the greatest changes that's the most difficult for many of us, including myself, is our limited access to the public. Our public engagement, our community meetings, just being out with all of you and the public has been very difficult for a lot of us. So with that, some of the other changes I want you to know about is we are starting a new state pandemic protocol. Other jurisdictions have been doing this protocol, and it's a portion of it is a no transport policy. And what that means is if you call 911 and you are having some of those COVID-19 symptoms, but your care would be better served at home, you now have the capability to stay at home if that is your choice instead of being transported to the hospital. And then one of our clinicians will follow up with you within 24 hours by a phone call. So you get the opportunity to talk to one of the paramedics. We go over your signs and symptoms. We see how you're feeling the next day, and then we can make another assessment that day of whether or not you want to go to the hospital or you'd like to remain home where it could be safer for you. That's something that'll start tomorrow morning at 0700. Another change that is difficult for a lot of people is family members are not allowed into the hospitals currently. Our two main hospitals, Anne Arundel Medical Center and Baltimore Washington Medical Center, are only taking the patients that we are transporting. There is a no visitor policy. This can be very difficult when we're on scene with patients and a husband or wife or a grandparent or a sibling wants to go with us to the hospital. And it's difficult for us to say no, just as it is for many other times. But it's important that you understand we can only take the patient right now, and the hospitals would not allow those visitors to come in with you anyways. The only exception is if you are a minor, then you are allowed to have one parent or guardian with you. But again, that can be a difficult conversation for my clinicians when you're on scene. So please keep that in mind if you need our services right now. The last thing is for adults and kids. We have just rolled out our annual report. I'm incredibly proud of the annual report. It's got some great photos of all of our first responders. There's some great information. You can find it on the county website under the fire department. It's over on the left-hand side toolbar, and just click on annual report, and it guides you through our virtual report. And then for kids and adults, if you haven't joined us on Facebook under Anne Arundel County Fire Department, you'll see we're adding virtual firehouse tours for the kids to look at. We've added friendly EMT and friendly firefighter videos so you know what we look like in all of our new PPE. And then we're continuing to add updated videos of home escape plans, how to be prepared in the event of an emergency, and maybe other additional items that you'd want to work into your homeschooling and homework. So my last thought is for all of our providers in the field and our first responders. Thank you for everything you do. I am incredibly proud of the work that you always do, but right now when the stress and the anxiety is so high and there is so much, I would say, so much reliance on you as the front line, I thank you for remaining calm and serving this community. I know that we have one of the best communities around, and it's because of what you do day in and day out. Thank you.